from Yamato. Bring Japanese wisdom and modern science into your daily life. I'm Ian Monk.
Hello! I'm Anne, apprentice to Inyan Monk. My master said he was too sleepy and left the rest to me, heading back to the temple. So, I'll be the one introducing this report to you instead. It's nice to meet you all. First off, to all the dedicated therapists and practitioners working hard for your clients every day, thank you for your tireless efforts. Now, regarding your daily work, I bet you frequently encounter clients struggling with sciatica, right? There might be times when progress feels slow, or you find yourself uncertain about the best approach. It can be challenging. When it comes to treating sciatica, we've learned various methods, like muscle relaxation and pelvic balancing. We've also studied diverse manual techniques and perspectives from Eastern medicine. Of course, these are all very important and effective approaches. However, have you noticed that in recent years, especially within Western medicine, the understanding of sciatica's causes and the philosophies behind its treatment have been gradually, but definitely, getting updated? For us therapists and practitioners, keeping up with this latest medical knowledge is becoming increasingly vital. It's essential for providing safer and more effective treatments. And just as importantly, it helps us give accurate information to our clients and ease their anxieties. So today, I want to dive into a topic that's often misunderstood but clinically very significant: new ways of looking at and thinking about MRI images. Let's explore this together. A herniated disc on the MRI equals the entire cause of the pain. Can we really be so sure about that? In this presentation video, let's update that common assumption together. First, a quick review. MRI is an excellent tool for getting a detailed look inside the lower back. It clearly visualizes the condition of the intervertebral discs and nerves, things that are hard to see on an X-ray. It can show, for example, a disc protruding and touching or pressing on a nerve, herniation, or the nerve pathway, spinal canal, becoming narrowed, stenosis. These findings help identify potential structural candidates for the cause of sciatica. But here's where it gets really important. The fact is, what we see in the MRI picture, the imaging findings, and the symptoms the patient actually experiences, like pain and numbness, don't always perfectly match up. This is becoming increasingly clear. Why does this happen? Let me explain the three main reasons in a simple way. Reason number one is, many people have abnormal findings on their MRI scans, even without experiencing any pain. It might be easier to understand if we compare it to wrinkles on a face. We all get wrinkles as we age, but having wrinkles doesn't necessarily mean that part of your face hurts, does it? The lower back is similar. Natural changes due to aging happen in everyone's spine. In fact, research shows that a significant percentage of healthy individuals with no symptoms have findings like herniated discs on their MRIs. So, even if an MRI reveals a herniated disc, it doesn't automatically mean it's the direct cause of the current pain. It could just be an incidental finding related to aging. Reason number two is, the nerves might be more inflamed or hypersensitive than the images suggest. MRI shows the shape of the nerve, like whether it's being compressed, but it can't accurately tell us how angry or inflamed the nerve is. Even mild physical compression can cause severe pain if there's significant inflammation present. Also, when pain persists for a long time, the nerve itself can become hypersensitive. Think of it like the volume knob for pain signals being turned way up. In this state, even stimuli that wouldn't normally cause pain, like a light touch or normal movement, can trigger intense "it hurts a lot" signals to the brain. This nerve hypersensitivity doesn't show up on an MRI scan either. Reason number three is, the imaging might look severe, but the symptoms could be mild. This can happen because the nerve might have adapted or gotten used to the pressure over time, especially if it developed gradually. Or, it could simply be due to the large individual differences in how people perceive pain. Psychological factors, like anxiety or stress levels, are also known to influence how much pain a person feels, regardless of the MRI findings. For these reasons, while MRI is a very important source of information when investigating the cause of sciatica, hopefully, you now understand that it doesn't determine everything. What's truly important is to use the MRI information as a reference, but always combine it with the patient's own story, their history and symptoms, and the physical examination findings to make a comprehensive clinical judgment. As professionals, we are required to adopt a multifaceted perspective and avoid making judgments based solely on images. In this session, we discuss the crucial new ways of viewing and thinking about MRI images for a deeper understanding of sciatica. I sincerely hope this knowledge proves useful in your daily clinical practice, in your explanations to clients, and in organizing your own understanding. Of course, the approach to sciatica involves much more than just interpreting MRIs. It encompasses diverse perspectives, including Eastern medicine, various manual therapies, and exercise therapies. I plan to continue sharing information useful for your clinical practice. Actually, I happen to know that my master's computer holds a treasure trove of amazing information he hasn't shared yet. If you all hit that like button to show you found this interesting or helpful, and subscribe to the channel to cheer me on and we're counting on you for the next one, well, that really motivates me to say, alright, I need to dig up some more. And maybe, just maybe, I can sneak peek, just between us, into the master's computer again and pick out some more useful info to share with you like this. So, please show your support. Also, if you have any requests like, I want to know about this topic next, or what about this condition, please let me know in the comments section below. I'll take full responsibility for searching the master's computer, haha, and see if I can find something relevant to share. Well then, thank you so much for watching this video all the way through. I look forward to bringing you some more secret info again soon. This has been an Indian monk's most trusted apprentice, or so I like to think.
If you found this video helpful, please like and subscribe to support the channel. I'll keep sharing traditional Japanese healing wisdom and tips for better health. Thank you so much for watching until the end. I really appreciate it. See you in the next video.